Today is 1st of July. It's National Doctors' Day. Yes, National Doctors' Day is celebrated on 1st of July in India every year. This day honors doctors across the country for their relentless service throughout the year. Doctors' Day is a tribute to all medical professionals who have ethically treated patients and served the society irrespective of all odds. In India, Doctors' Day is celebrated to honor the legendary Dr. Bidhan Chandra Roy, who was also the second Chief Minister of West Bengal. Here, the voice is mine, but this PPT is made by a doctor. He is Dr. Sanjay Kumar Das from Kolkata. He wants to create an awareness among us about corona through this PPT. So let's see. He is Mr. Bidhan Chand Roy. Date of birth is 1st July 1882 and we celebrate it as National Doctors' Day. The new normal. Dr. Sanjay Kumar Das, Calcutta National Medical College, Kolkata. COVID-19, Coronavirus Disease 2019, COVID-19. So, what you need to know? Severe acute respiratory syndrome coronavirus 2, SARS-CoV-2 causes COVID-19. SARS-CoV-2 is a new virus. The first cases were identified in people with pneumonia in Wuhan, China in late December 2019. It probably started in animals but is now spreading between people. As this virus is new, we are learning more all the time, and what we know now may change. Travelers have brought the virus into our countries. Many countries have now detected the virus in travelers. Some people who were in contact with these travelers were infected by them. It is possible that every location will have cases of COVID 19, although there is a lot we don't know yet about this new virus. We can still prevent the disease and stop an outbreak. Symptoms start like many other illnesses like fever, cough, sore throat, fatigue, shortness of breath, sudden loss of smell and taste, headache, muscle aches, and diarrhea. Symptoms start about 1 day after exposure but can be as long as 14 days. Some people have no symptoms, most have a mild illness. It can be severe and sometimes fatal. Diagnosis and treatment. Because symptoms are similar to many other illnesses, tests are needed to make the diagnosis through swab blood test. There is no specific treatment. Mild symptoms can be treated with medicine to lower the fever or relieve pain. If symptoms are more severe, treatment in hospital is required. To prevent COVID 19, maintain good personal hygiene. Wash your hands frequently with soap and water. Use alcohol based hand sanitizer when soap and water are not readily available. Cover your coughs and sneezes. Use a tissue or your upper sleeve. Immediately throw the tissue in a bin and wash your hands. Do not share food, drinks, and personal items, including mobile phones. If you have any symptoms, even if only mild, stay home and seek medical advice. Follow local guidelines. Corona cases. Typical presentation of a 4-month-old child with right-sided breast abscess. The infant turned out to be COVID positive on third day of her admission. Her mother was also corona infected. Corona cases. Chest X-ray of a COVID positive patient presenting with cough, sore throat, and fever. Protective equipment, that is N95 and 3-layered surgical mask. When to wear mask? Follow local guidelines. Wear mask if you are in a location with widespread transmission of COVID-19, in public places, confined or crowded environments. You are coughing or sneezing. You are caring for a sick person at home. or in healthcare setting. Masks alone don't protect. They should be used along with other hygiene measures. Follow manufacturer's advice for using the mask. Protective equipment, powered air purifying respirator. In short form, we call it PAPR. Protective equipment that are gloves and face shield. Hand sanitization, that is hand washing and alcohol using alcohol based sanitizer. Personal protective equipment, that is PPE. Attending OPD, we can see here that there are so many people here, they have come for checkup and all. He is Dr. Sanjay Kumar Das. OPD patient management, we can see here the doctors are sitting here to check the patients, or it is help desk. People are coming with the inquiry and the doctors are helping them. Social distancing, two persons should be 2 meters away from them. Social distancing at work should be 6 feet. Avoid exposure. Keep 1 to 2 meters or 3 to 6 feet away from others, even if they appear well, and avoid direct contact with them. Avoid touching your face, eyes, nose, and mouth, especially if you have touched objects handled by many people, such as handrails, door handles. Avoid shaking hands, kissing, or hugging. Instead, wave, bow, nod, or use any other culturally appropriate gesture to greet visitors, maintaining a distance of 1 to 2 meters or 3 to 6 feet. Avoid activities which expose you to large groups of people. Work from home where possible. Avoid non essential travel. Avoid exposure again. Clean and disinfectant frequently touch surfaces each day. More often, if you think they have been contaminated, use normal cleaning supplies. Keep away from people who are sick. Don't let them cough or sneeze on you. Avoid visiting hospitals and other medical facilities unless you need medical care. Are you ready for COVID 19? Prepare yourself and your family. Monitor the situation. Know your local health helpline numbers and be aware of the local procedures. Ensure you have access to essentials such as food, water, household supplies, and medicines. Speak to your doctor about any chronic medical conditions you may have and get them under optimal control. Consider how you will manage if authorities impose restrictions for a couple of weeks. Plan to be able to look after a sick household member. Get the flu shot. This will reduce the risk of seasonal flu and possible confusion with COVID 19 symptoms. It is isolation ward. We can see here that the patient is lying over here and the doctors are taking care of him. And these are the preparation going on for COVID patients. This is corona ward. This is isolation ward. A patient is lying here on the bed and the doctors have come to check him. What to do if you get sick? Do not travel. Cover your coughs and sneezes. Use a tissue or a mask if available and wash your hands with soap and water. Seek medical attention. Let the doctor know if you have traveled recently and if you were in contact with someone who is sick. If you don't need to go to hospital, stay home as much as possible. Do not go to work. Minimize contact with people until you have recovered. Screening and contact tracing is important to stop the spread of the virus. Screening may be done at entry points to detect sick people. You may be asked where you have been and your temperature may be taken. Health authorities may perform contact tracing, identifying people who have been in contact with someone with COVID 19. These contacts may be asked to stay at home for 14 days so they don't infect other people, to monitor their health for 14 days in case they develop symptoms. Follow the advice of health authorities. After travel to an affected area, monitor your health. Seek medical attention if you develop symptoms, following the local procedure for your location. When traveling to medical care, consider wearing a mask. use private transport, and avoid contact with others as much as possible. Ensure you provide your travel history to the medical facility. Coping with stress during the COVID 19 outbreak. COVID 19 can be stressful. The effects can be both physical and emotional. Things you can do to reduce stress. Take breaks from listening to, watching, or reading about COVID 19 frequently, including social media. Focus on the facts of COVID 19 and understand the risk to yourself and those you care about. Separate facts from rumors. Gather information from reliable sources. If stress continues to hamper your daily activities, talk to a doctor or someone you can trust. Keep yourself in the best possible health. Sleep well, eat healthy, and be physically fit. Teleconsultation. So we can consult through telephonic consultation. Thank you. I hope you all have got the better idea about corona and the risk from it and the ideas also how to deal with corona. That's all. Thank you.